So one thing I want to talk about before we go get our next patient that I haven't really talked about is the doctor always gives us a requisition. I've mentioned it a few times, but I didn't really explain what it is. And it says specifically some of the patient's symptoms and why the doctors sent the person for an ultrasound. So they tell us maybe what side their pain is on. We also ask the patient to see if there might be like a mistake in the rec.
Okay.
Because we want to make sure we scan according to what the doctor says, but also trying to answer the patient's question as well. I think that's a pretty good idea. It has a lot of information. It gives us the patient's name and their birthday and a little other information.
Okay.
But let's begin our next patient.
Okay.
How are you today? Good. So get to hop right up in the bed for me. Alright.
It's going to be really awkward to film delivery.
Okay. So on my rec today, it says you're having some pain in your back. Is that true? So you're having it more on one side, or is it just more on your right side? Right? And it's just like, is it more towards your back, or?
Yeah.
Okay. So we're going to take a look at your kidneys today. Even though the pain's on this side, we'll look at both sides.
Already.
Alright, so have you ever had an ultrasound before?
No.
Alright, so I'm going to have to get you to pull up your shirt just a bit so I don't have to keep it. So basically for an ultrasound, I just take a little camera and some gel to help me see. And then I just look in your stomach. It's not usually too painful. Sometimes we have to put a little pressure, or we might need you to take a breath in for us to move things. It's not too invasive.
So are we going to use a different transducer or the same one?
We are. We're going to use a different one because we're looking at the abdomen. We need to be able to see a lot deeper as opposed to like the vessels and the thyroid.
Okay.
So we use a lower frequency because it allows the sound waves to go farther down. It makes our picture maybe not quite as crisp, but we have to be able to see that far. Put this on, it might be a little cold. Right. Here's some of the kidney here. Sorry, I can't push it. You can see with kidneys, you have a brighter inside and a darker inside. Liver above. Just want to be sure that we scan right through. Look at it. This way. So this is cutting it through at a different angle. So there's lots of different things we do on our machine to make our pictures better as well. Measurement, full length. we have someone watching today. She's just kind of shadowing me and seeing if she's interested for studying this.
Okay, that's really cool. How do you get into this program?
There's lots of different ways to do the program. There's 2 years study some places where it's like intensive, and then at Dalhousie in Halifax, you can take 3 years and get your diploma, or you can do a 4-year program and also get both your diploma and a Bachelor of Health Science. So there's lots of different ways to do it. There's not a lot of options in the Maritimes, but there's quite a few out west, and also a few in Ontario and around.
That's great.
Taking a pretty good look on this side. I'm gonna just take a quick peek at the other side.
Okay. So do you guys write like an exam, or do you automatically get it when you're out of the program?
No, we definitely have to write a registry exam. We do it under Card Up, so the Canadian registry. So we are registered, but not licensed yet. We're working on that. But you definitely just can't become a sonographer without doing anything.
Yeah. So in Cardiff, can you be an ultrasound everywhere in the provinces, or?
Yep, it's recognized anywhere in Canada. This is the Canadian registry. There's also an American registry.
So nice.
There's your left kidney. You can see the echogenic center, less bright outer. Not a great angle, but you can see some of it there. I think we've had a pretty good look at that too. Alright, so I'm going to take my results to the radiologist and see if he needs any more images. And then I'll come back and let you know if you're good to go.
Okay.
It was nice having you here today to kind of watch over.
Yeah, I learned a lot, and I learned that ultrasounds aren't just about babies.
Yeah, well, that's a very important fact that a lot of people don't realize.